Hi there, this is Mark Manola from the Dental Wellness Center. I'm here with Mandy, my office manager and assistant. We're going to show you the new Promolife ozone unit. I love ozone so much that I have multiple different types of machines, but I want to demonstrate this one for the company. It's very easy to use, and for cavities, we're using a pen, which is really the easiest way. This is an endo pen, but we just put tips on that are sealed on the top so there's no leaking, and it is a flowable composite or an etch tip, and that's how we deliver the ozone. So there's a couple of delivery systems for ozone gas for cavities. There are two ways to deliver ozone now, with a tip, a direct tip, which gives you real accuracy if you're doing underneath an edge or something like that. But then there's another type of tip that's designed for just an occlusal surface, so you can attach this on here, and there's a kind of a cup. So what we're going to do is we're going to show you on here the delivery system this way. You can hold up. Is just putting it on, and it actually captures, completely covers the tooth, and this is a silicone and a little bit flexible, so it could be used on different types of teeth.
What's the benefit of using the cup versus the tip?
Yeah, so this is capturing and fumigating sort of in a nice area where it's being captured. Of course, suction's going the whole time we're doing this as well, but this does focus and capture in a like a dome-like manner where we can be doing occlusal surfaces for carriage control, before we do a sealant on the child or adult, a one-surface filling. But this can be used in a lot of indications, also for abfractions that are sensitive and we don't want to fill them right away, possibly, or just before we're doing bonding of any kind. Okay, that's what this is used for mostly. But it can also be used for bleaching, which is another use of ozone. But this tip would be more focused and fine-tuned, where we're going directly into the breath. And we're going to show on a patient after this how we utilize that. So another way to deliver ozone, the pen is the best way, and of course there is a pedal down here that we're going to use to deliver the ozone. So this is a side bore, which is used for endo or for periodontal pockets, and so this one we might use in a way where we can put a small bend on it and then put it in a sulcus or a pocket with this delivery system. Now,
With an extraction.
And with extractions, we're actually putting it in physically into the bone and bubbling up the ozone in the socket. And that's for vascular revascularization, for decontamination of the bacteria, and it also helps establish a clot by first causing bleeding, then the fibrin sets up and it actually clots. Of course, this is very convenient for dialing in whatever particular dentistry you're doing. We can dial in the amount of gamma that's associated with the procedure. So for ear insufflation, we use a very low amount of ozone, between maybe 6 and 12, and then we kind of go up for the effectiveness and the power of the ozone. So the way this is designed is the tanks here, we dial in about a quarter. For operative, for fillings, we want a quarter, which is liters per minute, and then we kind of come along here and we say, how do we get up to 50, whatever way we can get up to 50. So in this machine, it's pretty easy to use. We're just going to dial up to 8. And so 8 on a flow of liters per minute of a quarter is going to be 51, which is really good for cavities. Okay? So to activate the ozone, it's on red now. Here, you just hold this for 3 seconds and then let off. And now you can hear the machine go on. And now we're ready to do ozone. And I think we can have the suction. I think we're just going to demonstrate. The pedal is on the floor, so you don't have to touch anything. So when I press this, you're going to see that light go on. That light is my stepping on this, Okay, so it is active, and actually there's a pass through, and it's gone through a catalytic converter here, so it's not going to be causing problems. Now, sometimes I do use this type of tip for sockets, and then if I were doing any of the occlusal surfaces, or even, like we were describing with the doming pen. So this is nice. I have never done this, but this is really appropriate for all these areas. And patients can smell the ozone. We have our masks on, so there's ozone coming out of here, and sometimes we just ask the patient simply, do you smell ozone? Is it strong? We're always using the suction tight on the patient. That's really important to ensure that they're not breathing in the ozone or getting in their eyes, for that matter. I will say that the footprint of this unit, this Promolife ARC unit, is nice because I'm able to set this up here and leave it alone here. Now, you can also make water if we want to expand this. I can have the water being landed here. For now, we're just kind of using it for direct ozone gas. In fact, we could do the ear sufflation here with the patient sitting in the chair as well. We have a fan over in front of the patient, so it's being pushed out this way. So today we're going to be using Promolife's ARC. I'm going to show you the Promolife machine. It's a beautiful design. We have everything set up in the back here, oxygen underneath and everything. So my pen's ready, and we just need to dial in. We're going to be doing some operative, and we're going to etch first, and then we're going to use about 50 gamma on the surface of the tooth, and it kills the microbes. Everybody knows some of the things that ozone does, but it actually lowers the pH and helps with the bonding, we believe. So we're going to dial in a corresponding appropriate gamma, which is about 50. So we're going to do an 8 on here. And what we do is we hold for 3 seconds and it'll be on. So now it's on. And we like to run the oxygen through the machine a little bit first, and we like to let the ozone run just a little bit first before we do the treatment. So let's etch. It's very convenient to have the pen. Let's use that mouse prop, please. It's very convenient to have the pen because very familiar feeling for dentists.
Absolutely.
We're just going to etch first. Double etch technique is pretty much, my standard. Before this application, we prepped with a diamond the cable surface so that you get a nice bond. A lot of people don't know that carbide burrs actually polish the enamel, so we want to roughen it with a diamond. For the uppers, I usually isolate it with cotton. The lowers, I usually do the ozone first because of the saliva. The uppers pretty easy to isolate. Okay, now there's a foot pedal down here which you can't see. So you can see that you see the light going on. I believe you can see that. So ozone will be immediately coming out of here. And we leave a little bit of water. I like to leave a little bit of fluid because ozone works better in the presence of hydration. Well, whatever we do, we try to have a little bit of hydration associated with the ozone application. What we're doing is we're just frosting slightly, and about a minute or less, 30 seconds to a minute is going to be sufficient to kill any bacteria. And it frosts like the old days when we used to frost and desiccate the tooth, but that's pretty much the application. It's pretty easy to use. This is endo pens, and we use a composite tip on here or an etch tip. Okay. Have it nice and isolated here. You can see some of it frosting already a little bit. And we already etched, and now we're changing the environment. We're healing because the pH will change in the tooth. And then we're going to bond after this, just so we kill the bugs or desensitize the tooth, however you want to think about it.